Hello, and welcome to another episode of the Health Bridge podcast. I'm your host, Holly B. Today, I'm having a conversation with Dr. David Clarke. He is the president of the Association for Treatment of Neuroplastic Symptoms, which is a 501c3 nonprofit dedicated to ending the chronic pain epidemic. Dr. Clarke holds an MD from the University of Connecticut School of Medicine and is board certified in internal medicine and gastroenterology. His organization's mission is to advance the awareness, diagnosis, and treatment of stress-related brain-generated medical conditions. You guys, I am really excited about this conversation. The reason being is I think that this is truly the future of treatment for chronic autoimmune conditions. I believe really deeply that there are hidden root causes to autoimmune conditions that doesn't necessarily go along with the medical standpoint, the Western medicine standpoint of autoimmune conditions, but that is what I've come to believe over my years of working out my health conditions, as well as so many in the holistic space that I have learned from, that I have had on this program, others that have healed their own chronic autoimmune condition. I really believe that there are deep emotional triggers that are involved in our chronic symptoms. We're going to touch on all of that. We're going to get into what is neuroplasticity, what are neuroplastic symptoms, how does this relate to people with chronic health issues like chronic Lyme disease, like chronic fatigue, like long COVID, like any form of chronic pain, pelvic pain, things like that. The list really goes on and on. We're going to talk about specifically how these conditions oftentimes, not always, but oftentimes are actually considered a neuroplastic symptom. And the great thing about that is the word plastic is there because plastic can be changed, right? So these are actually symptoms that we can change if we dive deep enough to uncover those root triggers. So we're going to get into all of that and more with Dr. David Clarke. Before we jump in, I just want to say this episode is going to make you think of someone, if not yourself. I would love so much if you would share this episode with somebody that could really benefit from listening to this conversation. So once you're done listening, if it really hit home for you, if it made you think of somebody, please share it, whether you share it on your Instagram story or whether you like and comment if you're watching on YouTube or on Apple Podcasts. Anything like that really helps spread this message. And this is a message of hope that really needs to get out there. So I thank you ahead of time for that. And let's now dive into this really empowering and amazing conversation with Dr. David Clarke. Dr. David Clarke, welcome to the Health Bridge podcast. I'm excited for this conversation. We were chatting earlier, and I can't wait to dive in. So welcome.
Thanks, Holly. Great to be with you. I'm sure we'll have fun with it.
Absolutely. So you are a medical doctor that has a specialty focusing on neuroplastic symptoms. And we'll dive into what that even means. But I want to start with something that I read on your website, that the methods you use and teach, and I'll quote this, focus on uncovering stress, trauma, and unrecognized emotion. With this method, patients are able to take control of their symptoms without drugs, surgeries, or expensive treatments. I want to start there because I'm in the autoimmune space. I work with women with lupus or potential autoimmune conditions, and they're trying to figure things out. A lot of times they've had chronic pain, things going on for years and years that may or may not have been officially diagnosed as something. And so hearing that has got to be really appealing to a lot of people to know that there might be other options out there. So I'll let you dive into what that looks like with you and your patients, and maybe you can start going into what neuroplastic symptoms actually are and what they can indicate.
Yeah, well, you might not get a word in edgewise for the next 45 minutes, but I'll do my best. I have to say that to start out with, that I didn't believe any of this when I was in training. I mean, I am the most traditional Western trained person. And the first 7 years of my formal education, it was all about organs and structures, and the fact that any kind of pain or illness had to be due to a diseased organ or a damaged structure, and that's what we were needing to look for when we had a patient with symptoms. And I got into the 8th year of my training before I found out that there was this whole other category that we now call neuroplastic symptoms, which has to do with the brain and nervous system having changes. That's what the jargon term plastic means, a capacity for change, which can be in a bad direction or hopefully in a good direction. But when the brain's neuroanatomy changes, it can produce pain or illness anywhere in the body in the absence of there being anything physically wrong. It can be multiple symptoms that can go on for years or even decades. One of my patients was ill for 79 years. The severity can reach pretty much any level, same level as you can get with organ disease or structural damage. But the good news is that if we can uncover the psychosocial stresses, the traumas, the unrecognized emotions, other challenges in life, we can treat those successfully. And even people who've been ill for years, even that woman with the 79 years of symptoms was successfully treated with this approach. So there's a huge amount of hope around this. But I had to be dragged to it. I mean, I met this patient when I was in year 8 that I had no idea what was wrong with her. She'd come to us from another university, actually in San Diego, where you're based, and they had done the full diagnostic evaluation. They couldn't find anything wrong, which is actually the title of my first book, They Can't Find Anything Wrong. And we did some specialized testing on her. That was normal too. I was doing her exit interview and stumbled on the fact that she had been through a lot of trauma as a girl. This was 25 years in the past. I had no training that a trauma as a child could make you ill as an adult, but it turned out that's what was wrong. And a psychiatrist at UCLA, where I was in training, cured this patient in less than 3 months. And I was just blown away by that. And I said, if I'm going to be a complete doctor, I should learn a little bit about this. I might see another patient someday with the same thing, and I should know what to do. And it turned out that when I got into practice, every time I had a patient with normal tests, I would ask them the questions that Harriet Kaplan, the psychiatrist, had taught me to ask. And I was finding 5 or 6 patients a week that had these issues, that had basically what we call today neuroplastic symptoms. And I learned how to treat them successfully. It took me about 5 years to climb that learning curve, and I've never looked back. It's now 7,000 plus patients since the 1980s.
That is amazing. And I can only imagine that back in the 80s, this was, I mean, this is still kind of new information coming now, and we're in 2025. Back in the 80s, I can only imagine you didn't have many people to talk to about this.
No, especially when I went into private practice in Portland, Oregon, after I finished my training at UCLA. And I thought, if I discover one of these patients, I'm going to just send them off to whoever the Dr. Kaplan is in Portland. And it turned out there weren't any. It turned out that her skills were unusual. And most of the people got cognitive behavioral therapy, and it turns out that doesn't work very well. And the research has now confirmed that. It doesn't get into the issues that you need to get into to alleviate people's symptoms. These patients, a lot of them would come back. They'd say, I've been to mental health. I went through their program. I'm not any better. Now what do we do? And I had a basic framework. And even though I was pretty much a bumbling beginner at that time, these ideas are so powerful that people started getting better. And that was tremendously rewarding, as personally and professionally. And I just really loved doing it. It was only about 1/3 of my patients. The other 2/3, it was garden variety gastroenterology, which is my specialty, ulcers and tumors and liver disease and that sort of thing. But this other third, I just really enjoyed doing that work, and I got better and better at it. About 5 years in, I got the Doctor of the Year award from this huge HMO that I was working for at the time. And that was a big surprise because I was still in my 30s at the time. And that award usually went to people who were much more senior. So that was a great validation and encouraged me to keep going.
And I imagine, so at some point you started specializing now in this new field of neuroplastic symptoms, because I'm guessing that you felt like you're one of hardly any doing this work versus there are, I'm sure, numerous experts in the standard gastroenterology field. Is that right?
Yeah. No, that's right. Eventually I was in a 12-person department of gastroenterologists, and I was doing 90% of the second opinions for that group because just as it was for me, a third of their patients had these same conditions, and they would get the endoscopies or the biopsies or the ultrasounds or the CAT scans. Nothing shows up. Patients still got their symptoms, and they would send them to see me. And especially after I got that Doctor of the Year award, people found out about what I was doing, and they started sending me all kinds of patients that didn't have anything gastrointestinal wrong with them at all. Patients with back pain, women with pelvic pain, a gentleman with itching over every square inch of his skin for 3 years, just all kinds of stuff. But it always had the same underlying roots. And so I could get pretty successful outcomes for their symptoms, some of them in a matter of a few weeks or a few months. One woman, this is the one that I chose to be the first story in my book, she had been hospitalized at a major university 60 times in 15 years with no diagnosis. She'd seen a dozen specialists. At the end, they threw up their hands and had a psychiatrist come and talk to her, and he pronounced her mentally healthy, which is the case for the vast majority of my patients. They're at least as mentally strong as anybody else. But they couldn't find the cause for her illness, which was attacks of severe dizziness accompanied by vomiting that would half the time be bad enough to put her in this hospital. She was cured in less than an hour.
Wow.
Just by finding the stress that was directly connected to her attacks of illness.
That's impressive.
I was impressed. I went home and told my wife, I really think I'm onto something here, because I saw her when I was still a beginner, but the stress in her life was just so screamingly obvious. I couldn't believe that, especially the psychiatrist had missed it. But most mental health professionals are not trained to look for the kinds of things that can make people physically ill as opposed to having mental health conditions. And again, most of my patients, they're at least as mentally strong as anybody else.
And I want to talk about that too, because there is so much unfortunate gaslighting with specifically women autoimmune patients, because it's so hard to pinpoint so often, to pinpoint an actual diagnosis, because symptoms can range widely from person to person. And I mean, I talk to women all the time, and the stories of shame and, oh, you're just anxious, you're just depressed, you're just stressed, all these different ways of basically saying it's a mental problem, or
Makes
you
me
just need
want
to
to
chill out.
shake the doctors who were saying this.
Yeah. So talk about that when somebody has experienced all that, but they know that something's wrong with them. They know there's something wrong. Nobody can figure it out. Is that when they seek somebody like you out?
Yeah, except there's not enough of us, and so we're not that easy to find. That's why we started the nonprofit Association for Treatment of Neuroplastic Symptoms. The website is loaded with information, symptomatic.me. One of the best resources to start with is a 12-question self-screening quiz that can give people an idea if any of this that we're talking about today could apply to them. But yeah, these symptoms are absolutely real. They're not, quote unquote, in people's heads. They're not imagining them. One of my patients, just to give you one example, I was asked to see her on her 70th day in the hospital. She'd had abdominal pain for 18 months, unexplained. They put her in the hospital, and 70 days later, she was still there. She'd been seen by half a dozen other gastrointestinal specialists. She was getting morphine around the clock in massive doses. She was getting 10 milligrams an hour. 5 or 10 milligrams would be enough to alleviate the pain of a fractured leg. And she was getting this every hour. You're never going to convince a patient like that that these symptoms are not real. But what is not sufficiently widely taught to either medical or mental health professionals is to complete the evaluation. Don't just do the biomedical tests for structural damage or organ disease. Investigate for stresses in the person's life. And sometimes this is the simplest thing in the world. One of my patients, the only time he got his belly pains was when he was driving to work. Okay? When he's driving home from work, he's fine. On the weekends, when he's not at work, he's fine. If you ask that kind of question, the diagnosis is pretty straightforward. Anybody who's watching this could diagnose that he probably had some stress in his workplace. And sure enough, he had a ton of stress in his workplace. The other areas that we look into, we want to make sure that person doesn't have depression or anxiety or post-traumatic stress, that they haven't been through a trauma or a triggering event linked to the trauma. And you have to ask about that. There was a story told to me by a colleague of mine about a patient who was going from doctor to doctor trying to find out what was causing her illness. And he was the one who found out that right before she became ill, she had been a hostage during the robbery of a store. And she spent 40 minutes with a pistol pointed at her neck right before she became ill. I mean, this was post-traumatic stress disorder, and she had lots of symptoms of that as well. But the biggest single category that has to be investigated if you're going to do a complete evaluation of somebody with these symptoms is to ask about what they went through as kids. Did they have an experience as a child that they would never want for a child of their own? Or if they had to watch a child they care about growing up exactly as they did, would it make them feel sad or angry to see that? Because a lot of people, when they look back, none of us has a parallel life to compare ourselves with. So when they look back, they've just got their own life. It doesn't seem like it was all that bad a lot of the times. Many patients have told me, well, I did go through some stuff, but it wasn't that bad. Other people have been through worse. I think I'm over it now. But when I ask them to imagine a child of their own going through the same stuff, it gives them a completely different perspective, and they can recognize that it was a lot more difficult than they might have appreciated at first. And then we can start looking into what have been the long-term consequences of that. And we can understand that those are sources of stress. Certain personality traits like perfectionism or inability to take time for your own joy. Certain triggers. That patient who was hospitalized 60 times at the prestigious university, her dizziness and vomiting was getting triggered by her formerly abusive mom. And then the third big category, and the most difficult of all, are the emotions, which I've alluded to already. People can have incredible amounts of negative emotion of which they're not consciously aware at all. And those emotions, if they can't come out in words or in behaviors, they get expressed via the body.
Hey, I just wanted to jump in here and interrupt the program for just a hot minute. You know that I'm so passionate about this podcast, but what I'm also really passionate about is helping women with lupus minimize their symptoms, boost their energy so that they can indulge in life again. So if you are a woman who is struggling with lupus, who is sick and tired of being sick and tired, who's struggling to manage your flares, if you're finding that your lupus symptoms are just really getting in the way of you being able to live your life the way you want to, I feel you. I've been there myself and I felt the same way. And what I've found is that there are a certain set of health fundamentals that once applied will support you in your foundational health. They will support you in building and maintaining that energy, minimizing flares, and allowing you to, again, indulge in life and follow your passions. So if that is something that you are interested in creating for yourself, let's jump on a call together. I will walk you through the process that I use with my clients to get them from sick and tired to strong foundation of health by implementing my Health Bridge protocol. If this is something you're interested in chatting more about, I would love to talk to you. Apply for a free clarity call with me, and I look forward to getting to know you soon. And now back to the episode. Yeah, I can relate to that part of it because my journey into better health and better lifestyle really began when I started learning that I wasn't my thoughts. I could change my thoughts. I could start to recreate new thought patterns through neuroplasticity. And I had no idea that so many of the thoughts that were just on repeat, or emotions that were just on repeat, or scenarios that were just on repeat in my mind were not serving my highest and best purpose.
Yeah, that's a great way to put it. One of the questions I try to answer about my patients is, what did you learn about yourself as a child that isn't true? Because a lot of my patients, we're as human beings, we are creatures that learn. And the single most important thing we learn about is ourselves as individuals, me, myself, and I. Who am I? What am I good at? What am I not good at? And if you grow up in an environment where you are taught things about yourself that are false, you're going to carry that with you for a while. Those are going to become basic assumptions of how you think about yourself. So if you were taught you are a second-rate human being, you are not measuring up, you are worthless, it is your job in life to take care of the problems of everybody else around you and not to be thinking about your own needs or problems or concerns. If you are made to feel like taking time for your own joy is not something you deserve, all of these things just get absorbed into your worldview, and it can be carried with somebody for a very long time. And it can affect all kinds of things. The personality traits are stressful. The emotions are buried in there because when you were a kid, expressing those emotions wasn't going to be a good thing for you to do. So people, as children, learn to repress them. And so when the emotions come knocking on the door as an adult, you don't know they're knocking. They're just manifesting in your body instead. And the triggers, the reason that they're triggers, the reason that they're excessively stressful is because they are linked back to experiences that people had when they were kids.
And these experiences as children, the adverse childhood experiences, are we generally talking about more big T traumas versus little t traumas, like the more subtle things?
Yeah, what I used to believe was that the big T traumas were worse for you than the little t traumas, but it took me a while to figure out that that's not true. The little ones can be every bit as damaging long term as the big ones. My very first patient had one of the worst sexual abuse histories that I've ever heard. Her father basically assaulted her hundreds of times while she was a girl. The long-term impact of that, she had recovered incredibly from that kind of trauma and made a life for herself. It was just remarkable. That's why my patients who have neuroplastic symptoms they're heroes to me in what they've overcome. But people with smaller T traumas can have very similar outcomes in terms of personality traits, emotions, and triggers. Another one of my patients, I had to talk to him for probably 30 or 40 minutes before we figured out what was truly going on. And in his case, he told me that he never got praise from his mother and father unless he could do something better than his brothers and sisters could do it. And he had three very accomplished siblings. So it was not easy to do stuff, anything, better than they could do it. So he basically grew up feeling like he was a failure. And that leads people into all kinds of toxic behaviors, trying to be perfect, being extremely critical of yourself, being focused on getting so much done that you never take time for your own joy, you end up choosing people to be in close personal relationships with that, like the environment you grew up in as a kid. They have needs, they have issues, they have problems that you feel like it's your job in life to solve those things. And my patients have often chosen one toxic relationship after another, never really feeling like they deserve any better than that. And that obviously contributes to stress, those unbalanced relationships where my patient is giving 95% of themselves and they're only getting 5% back in that relationship. Yeah, little T trauma, it took me a while to learn this, but can be every bit as damaging in the long term. But like the big T trauma, it can be turned around. It can be overcome. It can be successfully healed.
Mm-hmm. Yeah, it makes me think of one of my clients who has a lot of perfectionism issues, but and thinking back to childhood, it's like, no, I had a good childhood, but she's finally identified that her parents were always saying, you don't need to be like the number one, just do the best you can. And so she held on to that, doing the best she can. And so she's always judging herself on everything she does. Did I really give it my all? Did I really give it my all? And she would end up feeling that less than, or feeling of not enough. And
You can always do more, can't you?
right,
Yeah.
exactly.
That shows, it's a great example of how powerful these pressures can be, and they can result from a family environment where everybody is trying to do their best.
Right.
That young lady with the 10 milligrams of morphine every hour that I was asked to see on the 70th day in the hospital, everybody in that family was doing their best. I mean, you could not fault what that family was doing. There was just an outside stress that had come in, and it interacted with another outside stress, and it produced a very toxic environment, and nobody recognized just how toxic it had become because everybody had good intentions.
Mhm. Yeah. So when people think back and say, oh, I really had a good childhood, I mean, I say that myself. I did. There was no abuse, there was no like direct anything that happened that you can pinpoint and say, oh, that was a trauma. But I think my perfectionism comes from something similar to what I just said about my last client of like, just do your best. And I have this, I've identified this feeling of I am not enough. And that's my theme for this year. I've talked about it on several podcasts, but addressing that issue of I am not enough. Let's flip that script. Let's do some neuroplasticity around that, because as much work as I've done, I've found that it is still lingering in the background. And I didn't realize it for a long time because I am doing a lot and I'm proud of all the things I've been accomplishing, but there's still that little voice in the back of my head saying, there's still more that you could be doing. I've found that seems to be a common theme with a lot of women in general, but especially within the autoimmune community is we give, we give, we give. We don't take enough time for ourselves. We put everybody's needs before our own. The things that we do, we want it to be perfect. And so I think, you know, I think this neuroplasticity is so incredibly important for this community of people to dive into.
Yeah, that is one of the most important and fundamental issues in people with neuroplastic symptoms, whether it's chronic fatigue or migraines or back pain or pelvic pain or irritable bowel or long COVID. The list is virtually endless. But if you trace it back to the roots, very often it is a feeling that a person is not quite good enough, or, for some people, not even close to good enough. And that can be created as a fundamental assumption inside of you in any of a range of ways. Some of them really bad, like the sexual abuse I mentioned, and some of them well-intentioned, parents wanting their kid to be the best person they can be. But they can create levels of pressure that the parents themselves have no idea they are creating. They're doing their best as parents to encourage their kids, but they're creating a level of pressure that's much higher than anybody appreciates. And kids will go through walls to try to meet those standards. And then as adults, they are living as if on a treadmill they never step off, and they don't take time for their own joy. And if they do have 5 or 10 minutes of free time, they're not thinking about pulling up a chair and getting a beverage and grabbing a book they've been meaning to read. They're thinking about something useful or constructive that they could be doing. And the outcome of that is that sooner or later, your body is going to force you to stop because nothing else is stopping you.
Yeah, I'm just seeing myself and so much of what you're saying. That 10 minutes of downtime turns into, I need to be productive. I need to be productive. What can I do? What can I do? And boy, that is a slippery slope when you start going down that path.
It is endless. And my approach to that is that, again, I go back, trace this to as far back to the roots as I can. And it has to do with a person's self-esteem, how they feel about themselves. And I ask people to imagine raising their own kid the same way that they were raised, whether they have a kid or not. Just imagine that you do. You have this child in your life that you love, and imagine that I take control of your brain for a week or 10 days and I force you to raise that kid exactly the way you were raised. And are you going to feel uncomfortable at various times doing that? And that's only for a week. So if you're going to feel uncomfortable or sad or angry about having to do this to a child you care about, then you have to recognize you went through that for, in round numbers, 1,000 weeks. And you have to look at that as a feat of heroic perseverance on your part. And that's exactly how I think about my patients, is that they have done something that meets the dictionary definition of heroic. Another analogy I use is that it's as if they had been parachuted into the Himalayas as a toddler, and they had to somehow find their way out of this environment. Even if it was well-intentioned, it doesn't matter. The pressure was still there. It's pressure you would not put on a kid of your own. A good example of this is a person who's actually fairly well known to the public on the East Coast and who was having probably half a dozen different neuroplastic symptoms in various locations in her body for 20 years. She was around 40 years old when I saw her, and she actually probably had them since she was a teen. And her childhood stress was that her parents verbally and emotionally abused each other. And she was the only child in the family, and so she was the peacemaker, as you might guess. And of course, as a child, she's not going to be successful with that very often. So she felt like a failure over and over and over again because the parents kept at each other. Okay, so finally, the parents get divorced. Great, she'll finally get a break from this. But no, the parents kept living in the same house. They slept in separate bedrooms, but they kept living in the same house. So from her perspective, nothing changed. And for another 10 years until she went off to university, she's having to deal with this. And I'm trying to help her to see that this must have been just absolutely horrendous for her. The only kid trying to be the peacemaker, failing repeatedly, getting this message that you're not good enough in an absolutely uncontrovertible way. And she's saying, no, I don't think that's it. I don't think this was responsible for my physical symptoms. It just wasn't that bad. I know other people have been through worse. Nobody molested me. Nobody beat me. And so fortunately, she had a 5 or 6-year-old niece who lived in the same city that she did and whom she absolutely adored. And she would take her for the weekends and take her to the movies, take her shopping, and take her to restaurants. And so I said, okay, we're going to imagine that your niece is in your childhood household, and you are a butterfly on the wall watching your niece try to deal with that for, let's say, a week. And you can't do anything because you're just a butterfly on the wall. This is a thought experiment I use a lot in my practice. And she just stared at me. Very verbal person. But for a couple of minutes, she just stared at me while she processed this thought experiment. And at the end, she said, at the end of that week, I would shoot myself.
Mm.
And that was the first time she truly recognized just how bad it had been. And the purpose of this thought experiment is not to traumatize people. It's to help people get a a realistic sense of how much they had to overcome to really appreciate their own heroic perseverance. And when they can do that, when they can internalize that recognition of their own strength and their own persistence, it gives them a completely different self-image that's based in reality. We're not just doing blind affirmations here. We are making a fundamental change in how we look at our own lives when we do this. And she was very successful at that. And she was in one of those unbalanced toxic relationships, and she dumped the guy the next day and did not have another boyfriend. She had a whole string of toxic boyfriends going back to when she was in high school. And she went without a boyfriend for the next year and a half while she just processed thinking about herself in a completely 180-degree different way. And her next relationship, they've been happily married for 10 years.
That's awesome. So we've been talking a lot about these chronic patterns, chronic symptoms. How does this apply to, I know you work with chronic pain. So many people that are in chronic pain end up taking pain meds and becoming addicted to pain meds, both in and out of the pharmacy. And I'm curious, I think you do some work around that as well. I'd like to know kind of what application neuroplasticity has with people that are in that much dire strait with their chronic pain. Really quick, Holly B here. I just wanted to interrupt the podcast to ask you for a quick favor. Can you take just a moment to like and subscribe to this podcast on whatever platform you are listening in on? It makes a world of a difference. And the reach of this podcast, it takes like literally under 10 seconds. So go do that right now. Thank you so much. I really appreciate it. And now back to the episode.
Yeah, it obviously depends if it's neuroplastic or not. A majority of pain, chronic pain, is actually neuroplastic. The percentage in spine pain, for example, has been shown in a recent study to be 88% of spine pain is neuroplastic and not structural. But if you've got chronic pancreatitis, for example, I mean, that's chronic pain from an inflamed organ of your pancreas being inflamed, and that is not neuroplastic. And so we have to try to work with pain medications and nerve blocks and other ideas that are focused on doing what we can for that organ. But if it's neuroplastic and the patient has got a program of opioid medication, for example, I'm not going to change that right at the beginning. You can't just take that away from somebody unless you're replacing it with something better. And that's what neuroplastic treatment is all about. The Boulder back pain study took 150 people with back pain for an average of 10 years, randomly divided them into 3 groups. One group just kept getting their regular care. Another group got a big injection into the spine, and the third group got neuroplastic psychology. And all they got was 8 sessions, 2 sessions a week for 4 weeks. And the pain levels dropped by 75%. So you have to imagine these people, 10 years of chronic low back pain, and in 1 month with neuroplastic psychology, 75% improvement. And they followed them up for a full year of the study to see if the pain came back, and it stayed down 75% on average in this group that got the psychology treatment. So that's my approach, is to use the neuroplastic approach, and then as people start to feel better, we can start ratcheting down the opioid dose and do it slowly so that the withdrawal impact is minimized.
Mm-hmm. And the people that were, say, in this Boulder study that have chronic back pain, I assume some of that could have been from an actual injury or trauma.
Yeah, a lot of times it starts with an injury or trauma, or people can point to, oh, I bent over to tie my shoes, or some other kind of, I was lifting a table. And so you get an acute injury. And acute injuries typically will heal in 4 to 8 weeks, tops. But some people, the pain continues. And in the vast majority, especially if there's not any evidence on exam of nerve damage, Those people, it's neuro 88% of the time in the case of spine pain. And there are brain scan studies now that show that the location in the brain when your pain is acute, when it's happened right after an injury, is different than the location that lights up when the pain has become chronic. It moves from certain areas deep in the brain over to areas that have to do with emotions and the meaning making, those kinds of more thought connected areas of the brain. So there's real physical underpinnings to neuroplastic symptoms, that circuits in the brain are actually different. The Boulder back pain study, they also scanned brains and found that the brains physically changed in response to the neuroplastic psychology. This is when people say, "Are you saying this is in my head?" My response to that is, no, it's in your brain. And it's as real as any other form of illness or disease.
Uh-huh. And then a couple other ones that I wanted to touch on too that you work with. You've mentioned Lyme's disease and long COVID. Could you talk a little bit about those?
Yeah, chronic Lyme, it turns out there's no scientific evidence for it. Acute Lyme, where you get the infection with the spirochete organism that's successfully treated with antibiotics, absolutely real. But chronic Lyme, there's a lot of doctors out there that will diagnose you with that, and there's no evidence for it. And there are blood tests that can show you've got an antibody, but the antibodies persist in your body long after the infection has been successfully treated. Yeah, chronic Lyme, mainstream physicians, myself included, simply don't believe that exists, and that patients should be assessed for a neuroplastic cause to their symptoms and treated for that. And it's much more likely to be successful. Because I didn't mention this earlier, and I should have, 40% of people who go to the doctor, their symptoms are neuroplastic. There is a study, I believe the authors are Haller and Kramer, 2015. They surveyed, 36 different research publications from 24 countries. And that's what they found, is that about 40% of people who go to the doctor have a neuroplastic symptom. It's 1 in 5 of adults in the general population that have this. And if you go to the doctor with a symptom and you get the diagnostic tests and they don't show something, then the probability of your symptom being neuroplastic is probably 90% plus. And you mentioned also long COVID. Long COVID has been associated with close to 200 different symptoms. I'm not aware of any biomedical condition that can do that, except a neuroplastic process, which does that all the time. I mean, the patients that I've seen over the last 40 years, 7,000 plus of them, they've had symptoms from head to toe. And long COVID is actually not more likely after COVID, any more likely after COVID than it is after flu. And it's also quite common in people that before they got diagnosed with long COVID, they had one of these other neuroplastic conditions. If I personally was diagnosed with long COVID, the first thing I would do would be to start an assessment for neuroplastic causes, followed by treatment.
And then chronic fatigue also, I guess, would follow along with that.
Yeah, there was a pilot study done at Harvard. In fact, Harvard also did a back pain study that corroborated the results of the Boulder back pain study. UCLA also did a musculoskeletal pain study that corroborated the results of the Boulder back pain study. So it's not just one piece of research, we're getting confirmation from across North America. Halifax has published on this as well. But yeah, long COVID pilot study, Harvard, 23 patients with long COVID sorry, did you ask me long COVID or chronic fatigue?
Both, but chronic fatigue was the next.
Yeah, chronic fatigue, they found that also has a strong neuroplastic component. Let's put it that way. I've written brief blog posts about a lot of this research on the symptomatic.me website. If you look under the blog section, you'll find summaries in plain English of this research. Long COVID, chronic fatigue, back pain, the Boulder back pain study, they're all in there.
Okay. Yeah, because I'm thinking back and looking over my 20 plus year now experience with my health journey. And I always say there's two starts to the story. The first start was getting mono in my early 20s. which never really went away, turned into a chronic fatigue diagnosis. My labs were fine, but I wasn't right. I wasn't well. I wasn't thriving. And so I went down this meandering path trying to figure it out on my own because I wasn't getting any help from the medical doctors, at least at that point. But the first start to the story was a abusive, traumatic, tumultuous relationship leading up to that. And so everything you're saying just makes so much sense to me. And I wish that I would have known then what I know now and could have started this work so much sooner.
Yeah, there's no question. I mean, that's why the Association for Treatment of Neuroplastic Symptoms exists, is to share this information not only with healthcare professionals, but with the public. We take a lot of care to try to put all our writings in plain English so that people can understand what this is all about, and follow this pathway along with us. We provide lots of different resources, courses, even the courses for professionals are done in plain English. And our textbooks, which have the title using an older term, psychophysiologic disorders, those are written in plain English too. The psychophysiologic disorders is the most technical term you're going to see in the whole book. And we've got a self-treatment course on there. And we've got a new podcast, I should mention. We just launched it last week. It's called The Story Behind the Symptoms. And it's me interviewing a patient, trying to come as close as I can to what I used to do in my office for decades, and to uncover a lot of the issues that we've been talking about today in an individual patient. And we're going to be releasing these every week or two now, starting next week. And there's already one that's out there that's fascinating. The person was ill for 30 years and made a full recovery.
Amazing. I love that you're putting those stories out there, and especially so people can see and understand that process of what that uncovery process looks like.
Yeah, she did a wonderful job of expressing not only her journey with respect to symptoms, but also the kinds of ideas that led to her recovery.
Mm-hmm. I think we've covered so much here. Before we go, I want to ask you if there's anything that we didn't touch on or anything else that you'd like to leave our listeners with.
I definitely want to leave your listeners with hope. I've talked about some of my more severely ill patients along the way, and that even those were able to respond well to neuroplastic psychology treatment. Another one, 55 years of abdominal pain. I saw him back before we had electronic medical records, and volume 3 of his paper chart was 3 inches thick, just full of tests that didn't show what was wrong with him. And he had been physically abused as a boy rather severely, and it was still affecting him at age 74. His pain started when he was 19, but he was successfully treated. Within a month, his pain was gone. I want to emphasize, not everybody gets better that quickly. I mean, some people need years of psychotherapy to achieve that level of outcome. But even people that are going to take a while, at least they know that they're on the pathway toward eventually getting there. Absolutely tremendous hope for this. It can be diagnosed and treated at least as successfully as my other patients.
Thank you so much for sharing everything. I will make sure we have all of your links and your website in the show notes so that people can take a look at your website, do the self quiz, maybe take some courses. I love that you say that it's all in understandable English. It's not in total practitioner speak, so that anybody can take those courses and learn and benefit from this. Yeah, this has just been an amazing conversation. Thank you so much for being here.
Thank you, Holly. I really appreciate your help in sharing this word with your viewers.
So many things that Dr. David Clarke spoke to really hit home for me, and I'm wondering how much they hit home for you as well. What did that conversation bring up for you? One of the things that I'm carrying with me from this conversation is the perspective shift, when somebody has gone through anything traumatic or trying, to look back and see that heroic perseverance. Dr. Clarke was speaking about how his patients, he looks at them and sees just the heroic perseverance that they survived through, right? And that's such a powerful perspective shift. If we can step back and look at our challenges in that light, what kind of a difference would that make in your life? I want you to think about that and have that be one of your takeaways too. Also, can it put some perspective on somebody that maybe somebody in your family, some of your friends, maybe a coworker? Maybe use that to give a little benefit of the doubt. Not We're in such a strange climate these days. Politics have shifted considerably. People are reacting. And I just want to put that out there as a broader perspective too, that if there's somebody that maybe you struggle with or don't understand where they're coming from, perhaps they've gone through some things, and perhaps the idea of heroic perseverance would apply to them too. And maybe even if you can't get along with them now, maybe you can still have that respect for them and for whatever it is that they struggled with in their life. So take that one more as a side note, but I just think it's really important to hold on to that perspective, and it helps you maybe relate a little bit more to other people, as well as love yourself a little bit more and respect yourself a little bit more for everything you've gone through. Lastly, I want to bring up the statistic that Dr. Clarke said at the end there. 40% of people who go to the doctor actually are suffering from neuroplastic symptoms. 40%, that's almost half. That's almost half. I encourage you to go to his website, symptomatic.me, to take that quiz and start to just consider if that might be something that relates to you or some of your symptoms. I've known for quite a long time that I've had, I didn't have a name for, I didn't know what it was called. I didn't know it was called neuroplastic symptoms, but I've known for quite some time that there was so much emotion and trauma tied into that first case of mono that I had, and strung out from then until now with things that I've held in my body because I haven't known how to process for a long time. And I have to tell you, it's rewarding work to start diving into this and to start to unpeel those layers of the onion and to find those jewels that are inside and find yourself and your joy in that process, and come back to who you really are and that hero that's inside, right? So please, again, go to his website, use his resources, take his courses, you can also find practitioners through his website. As he said, there's not enough of them, which is why he is doing this work to train other doctors and other types of practitioners in these methods so that we can spread this awareness and help people really get better and get through their symptoms, at least minimize, if not take them away, right? If you are ready to dive into this and you want a coach to help you along the way, I do discuss a lot of this neuroplasticity with my clients and in my course. It made the biggest change in my health journey. I want that for you too. So if you are ready to start to dive deeper behind the symptoms, sign up for a free call with me. Let's do a free health strategy session. Let's talk about this a little deeper and see what benefit might be for you on the other side of going through my course and working with me one-on-one. It's a free call. The link is in the show notes. And I really look forward to seeing you on another episode of the Health Bridge podcast and hopefully meeting you over a free Zoom call very soon. Thanks for listening.